Welcome to OakLeaf Surgical Hospital. We look forward to meeting you for your upcoming surgery. In this video, you will find useful information for you and those helping to take care of you when you are home. Some items we will cover in great detail, and others you will be just introduced to, as they will be covered in more detail during your stay. If you find you have questions about home safety, equipment needs, or the ability to manage the post-operative routine, we suggest that you speak to your physician about a pre-operative physical therapy visit. At that visit, a physical therapist can educate and assist you in getting your discharge planning for home all taken care of, including a walker, crutches, bathroom equipment, and to teach you your exercises. Some individuals also need extended stay at a rehab facility to gain independence. Please speak with a discharge planner at OakLeaf Surgical Hospital regarding this. The more you are educated and prepared, the smoother the hospital stay and rehab at home will be. With each session of physical therapy at the hospital, you will practice a series of exercises. These exercises are meant to build up your strength surrounding your hip and prepare you for the next phase of exercises that comes during outpatient physical therapy. We recommend that you attend physical therapy when you leave the hospital to help complete your rehab for strength, range of motion, balance, coordination, and community activities. We want you to get back doing everything you want to do. We are going to start with an exercise to help improve your circulation and reduce your swelling. So we're going to start with some ankle pumps. I'd like you to pump your ankles up and down, and you can go ahead and do it on both sides, your surgical and your non-surgical side. Pull them up as far as you can till you feel a stretch, and point them all the way down like you're pressing the pedal on the gas. We want to do 10 to 20 repetitions every hour that you're awake. Next, we're going to move on to the quad muscle. Quad muscle is on the front of your thigh. So what I'd like you to try to do is tighten up that quad muscle and push your knee down into the mattress of the bed. You'll find that doing your exercises on the bed is going to be the easiest place. Now hold these quad sets just a little bit longer and relax. Tighten and relax. Tighten. And one more. And go ahead and relax. 10 repetitions 3 times per day for this exercise. The next exercise is going to be for the muscles surrounding your hip. This is close to where your incision is, so it can be a little bit more sore, but it's important to help for your sit to stand and getting out of bed. So we are going to tighten up the gluteal muscles. You want to do both sides for this one. So go ahead and tighten the muscle and relax. Tighten and relax. A little bit slower. Tighten and relax. That's better. One more. Excellent. Now it's important to remember that you'll get some handouts to take home with you so that you'll be able to follow through that handout and know exactly what to do at home. Next exercise is called a heel slide. The heel slide is meant to produce some range of motion and stretching for the knee and the hip. Now, if you have any range of motion restrictions, your physical therapist will let you know that as you continue to progress with these exercises. But what we want to start with is just stretching the knee and the hip to tolerance, no pain, okay? So I'm going to have you go ahead and bend your knee and slide your heel on the mattress to where you feel a stretch and then come back down. Now, you might feel the stretch anywhere from your hip through your thigh. So anytime you feel that stretch, then you can go ahead and just straighten your leg back out. Go ahead and bend your knee and then back down. Now, if your mattress is really soft at home, you might need something firm like a piece of plexiglass or even a baking sheet underneath your heel, and that can help create less friction so that you can do this exercise a little bit easier. I'll have you do a few more. One more. Very good, and let it rest down completely. Oftentimes when you lay your leg down flat, you'll also feel some stretching across your front of your hip. That is all very normal, just due to the swelling, the bandages, and the fact that you've been laying in bed for a couple hours. All right, ready to go for a walk. So we are going to use this front-wheeled walker. I understand you've got one of these at home ready to use, and this is the kind that is going to be the safest for you right now. So we are going to work on standing up. Now it's important to remember that after that hip surgery, to be a little cautious. So when you stand up, I want you to stand straight up. Don't lean forward at the waist and then come up. I want you to stand straight up, and you can use your hand on the mattress to help with that. So I'm going to have you put one hand on the walker, one hand on the bed. You can use both legs to push with. Weight bearing is tolerated, which means you can step on that leg with enough force to give your body support, but don't cause any pain. Okay, so I've got this belt around your waist so I can help you with standing as well. So why don't you go ahead and stand up and get your other hand to the walker and just kind of get your balance there. And our first couple steps are going to be small, short steps, but I'm going to have you move the walker forward, and then that surgical leg goes first, and then the good leg, okay, and then the walker and the surgical leg and the good leg. And let's just take one more step. Walker, surgical leg, and good leg. So when you are standing, the crutches should hit against your rib cage, and you should have a little bit of a bend in your elbow so that you can stand up nice and straight. Okay? Now again, your weight bearing is tolerated, so you can use your leg to help support you. So I want you to go ahead and move the crutches forward, and then the surgical leg, and then the good leg. And then the crutches, and the surgical leg, and the good leg. And let's do one more step. Crutches, surgical leg, and good leg. Your mobility is very important to us, and we want to make sure that you choose the right assistive equipment for at home. So we have chosen a walker with wheels on the front of it. You may have seen friends of yours, or you may even have other options of walkers at home. There's walkers with no wheels on them, and those are often a little cumbersome, a little slow, and don't let you move very fluidly. They also make walkers with the 4 wheels on them, with the seat and the brakes. Those are a little too loose and a little too unsteady and therefore unsafe when you're walking. So this really is going to be your best option. If you have a walker where you can swap the wheels out, you can often purchase those at the drugstore, or you can sometimes pick up parts and pieces at secondhand stores or community loan closets. You have lots of options, but let's practice with this and see how you do with that. So we are going to work on just trying to walk a longer distance, like down your hallways at home. So your best option is going to be to push the walker forward, move your surgical leg forward, and then your good leg. And then just push the walker right along, move your surgical leg, and then your good leg. Yep. And continue to push. And this allows you to kind of have a nice, steady, even pattern without having to get hung up on carpet and different concerns. This walker will push right over any surface. Perfect. Crutches are also an option for you to walk with. Sometimes people like them when they're, in tighter spaces, again, kind of like in the bathroom areas or in through small kitchens. Some people also just like to have one set on one level of the house and the other set on the other level of the house. So you have many options for getting around. But the pattern with the crutches is the same as with the walker. It doesn't change. You're just using a different device. So you want the crutches to go forward. The surgical leg should land right in between the crutches. Yep. Bring your good leg forward. Bring the crutches forward. Surgical leg, and then good leg. Good. Let's take one more step. Perfect. All right, we are going to practice the stairs. And one of the questions a lot of people have is, can I do the stairs? Is it safe to do the stairs? And the answer is yes. We will teach you how to do the stairs. And in fact, we want you to do them so that you have your independence. Some people need to look around their house and look at where they're going to enter the house, or if they need to get to a different floor of the house and install a rail. Doing the stairs with a rail and one crutch is probably the safest, most secure way to do that. So if you have someone who can install a rail on your front porch or going up to your main living level that's sturdy, I would go ahead and do that. So let's practice this pattern here. You're going to have one hand on the rail and obviously your crutch in this hand. And what we're going to do is we're going to go up with your good leg first. That good leg is going to take the first big step for you. So go ahead and go up with your good leg, push up, bring your crutch up, and bring your surgical leg. Yep. Go up with your good crutch and surgical leg. Okay. Go ahead and walk across this platform. I'm going to have you go down with your crutch, and your surgical leg goes next, and then the good leg. Yep. Crutch, surgical leg, and then the good leg, and then crutch, surgical leg, and the good leg. And then someone can either give you your other crutch, or maybe your walker is waiting here for you, and then you can continue on your way. Okay. There'll be times when maybe you're outside of your house, out in the community, or maybe if you need to navigate a curb, that there's not going to be a railing for you to use. So using two crutches is the pattern, or is the option, I guess, that you want to use. So when you're going up the stairs, you still want to go up with your good leg, then the crutches, then your surgical leg. So let's go ahead and practice. Up with your good. Oh, bring those back down, actually. Keep your leg right there. Stand up with your leg and bring your crutches up. There you go. So go up with your good. Yep. All right, walk across the platform. You're going to want to come down with your crutches. Surgical leg is going to come down first, and then your good leg. Surgical leg. Crutches, surgical leg, and then your good leg. And now you're all set. Now you can just take off walking. Mm-hmm. All right, we are going to show you how to get on and off the toilet safely. So we have taken a standard toilet and we put a commode over the top. Now the commode has the handles on the left and the right. You may be able to use rails if you have those in your bathroom, or if you have a vanity that's really close to you that's sturdy, you can use that. But for safety purposes, the commode with the handles is probably the easiest and most independent way to go. So I'm going to have you back up and we're going to sit down on the toilet. So one hand onto the commode handle and then lower yourself down. Yep. And sometimes it can be a little sore to sit on that hip incision, so you kind of got to adjust yourself appropriately. Then for standing, remember with your hip precautions, you can't lean forward. We want you to stand straight up like you got a stack of books on the top of your head. Okay. Also remember when you're sitting on the toilet is to relax this knee enough so that this knee stays below the line of your hip. That will make sure that your hip doesn't have risk of dislocation. Okay? So we're going to stand back up. I'm going to have you put one hand back on the walker. All right, you got that stack of books on your head. You're going to push up. Get your other hand up to the walker. You can pull your surgical leg back underneath you just a little bit, and you're all set. You will find in your joint venture handout that there will be a lot of information regarding shower equipment. Some people have walk-in showers or stall showers. Other people have the traditional tub shower combinations. What's going to be important for you is to look at your house and see how much equipment your bathroom can tolerate from a size standpoint. They make tub benches. They also make extended tub benches that can sit with adjustable legs on the bottom of the tub, the bottom of the shower, or partially in either option. A lot of times if people aren't sure what to do, your best person to talk to is going to be your local physical therapist that you're going to be working with after surgery. They can help navigate the equipment that's available, where it can be rented or purchased, or sometimes even borrowed through community loan closets, and help get that adjusted to make sure that it fits you from a size standpoint and also fits well within your bathroom. All right, as we get ready to leave the hospital, we want to make sure you've got enough independence to get in and out of your car safely. So let's start walking towards the car to practice. We also want to make sure that you can get to and from your physical therapy and your doctor's appointments. You will need a driver for the first few weeks, but you'll be able to ride in the passenger side of the vehicle. A little practice getting in and out will help make you feel comfortable. We have reclined the seat and pushed the seat all the way back. So I'm going to have you walk up to the car, You're going to go ahead and turn, yeah, until you're facing the side of the seat. All right, step back as far as you can, and you're going to have to try just to perch on the edge of the seat, and then I'll help with your leg. So let's get a hold of the console. All right, use your good leg to boost up and slide back. Yep, and then go ahead and spin that leg into place. Go ahead and you can start to scoot yourself to the edge of the seat. Bring your leg over, keep scooting. Yep. Slide to the edge. Yep. Get your hand on the walker and push up through your good leg. Hopefully the information you've gained here today has been helpful to you and your family members as you prepare for your upcoming surgery. If you have any questions regarding any of the information, please reach out to one of your providers. On behalf of OakLeaf Surgical Hospital, we wish you the best for a speedy recovery.